welcome to Meditrack program. And today we are going to discussing about breast related health issues. In this session, today we have Dr. Prajwal sir, Dr. Sruthy ma'am, cosmetic gynecologist and fertility specialist, Dr. Prajwal sir, plastic surgeon, Sashirekha Hospital, Kanhangad. See ma'am, we are going to discussing about breast related health issues. Especially if you see women, what are the common breast related issues you are facing? You can see in the woman.
Yeah, that's what. See, breast related issues in a female starts in all. I mean, you can tell every age group of, from a girl to a older menopausal age group also.
Okay.
They can have breast related issues.
Okay.
Small girl also can have a small nodule kind of a thing in a breast lump, what we call. It is most commonly benign since non-cancerous lesion itself.
Okay.
But then it is of something which has to be concerned.
Okay.
So it starts from younger age group also. So these are all the things like breast lump or some abnormal discharge which can happen because of hormonal imbalance also.
Okay.
Certain level of hormones are increased, so they will start having milk secretion.
Okay.
Other than feeding a baby, other
Okay.
than that time also they can have those things because of certain hormonal imbalance.
Okay.
So next comes your reproductive age group. That means breast changes, not only it might be a disease, but
Okay.
normally also a female's body has a lot of changes.
Okay.
Because from puberty, once they get their periods,
Yeah.
from then their breast development actually starts.
Okay.
From then, once they get pregnant, during pregnancy there are a lot of breast changes happening.
Okay.
Be it pigmentation or small nodular structure around the nipple. So those are all normal.
Okay.
Even the size. Yeah.
Okay. See, ma'am, these one all cosmetic issues. How it related to health issues?
See, these, that's what. See, some people consider health issues also and cosmetic issues also.
Okay.
See, these pregnancy changes, definitely it's not a health issue. It's a normal thing.
Yeah.
Lump or abnormal thing is all, it's an health issue.
Yeah.
So that needs immediate attention.
Okay.
But physiological changes, whatever happens through pregnancy and post-delivery, during feeding, is a major time where your breast has a physiological cosmetic changes which is happening.
Okay.
And as the older age group comes,
Okay.
so that will be physiological plus health issues also.
Okay.
Be it be mass or any changes or any heaviness, or it might be pure cosmetic. Like imagine when you're feeding, when a mother is feeding a baby, baby is drinking only milk only from the one breast,
Okay.
only from the right or on the left breast. So
Okay.
there's breast size discrepancy.
Okay.
One is bigger, one is smaller. So we usually tell them, don't do that.
Okay.
Feed in both the breast equally. So that's when your cosmetic concerns comes into picture.
Yeah. Yeah.
And definitely if the baby is feeding on both the breasts also, there will be size changes, there will be heaviness, there will be sagging of those breasts.
Okay.
So depending on the heaviness of the breast, then she might have health issues later on. That is
Okay.
back pain or she's not able to, the heaviness, the weight of it. So all those things will hamper her day-to-day activities also. That's when your health issues comes because of this reason.
Okay. See, Prajwal sir, what is the role of plastic surgeon here?
See, when you tell about breast issues in the females, we can divide this into two things.
Okay.
One, functional problems.
Yeah.
There might be actual health issues in the breast itself. Like how
Okay.
madam told,
Okay.
there may be some small lump in the breast.
Yeah.
There might be some cancer in the breast.
Okay.
There might be some white discharge can be there. Sometimes some cyst or abscess, in the sense infection can happen to the breast. These are the problems which patients will have, and they will have some pain, swelling, tenderness will be there. Such things is dealt by general surgeon or plastic surgeon, anyone, like any surgeon can handle that issues.
Yeah.
But when you tell something about cosmetic concerns in breast,
Okay.
usually as madam told, it can be divided into two age group. One in a younger age group, one in a older age group. In a younger age group, usually there is, for instance, one of the female, she will not develop the breast tissue at all. So
Yeah.
as madam told, when you get the at the age of 13-15 years, they will attain the menarche.
Yeah.
Then after that, they will develop all the secondary sexual characters, that is
Yeah.
breast enlargement and other things.
Yeah.
If that doesn't happen, so it will affect her very, very badly.
Okay.
So every female has a good breast, and
Yeah.
if she doesn't have any breast, so
They
obviously
have
it is
emotional
considered.
problem. Yeah,
Yes,
correct.
it is always emotional problem
Yeah,
there.
yeah.
So such issues we can treat with, we can enhance the breast tissues by our surgical methods. And if you go in the middle age or older age group, what happens is after multiple pregnancies, there
Yeah,
might be
sag.
extra sagging of
Sagging
the
of the
breast
breast, yeah,
tissues, which
correct.
will cause obviously unnecessary social tension also, because
Okay.
they cannot wear the bra. and every time they cannot wear the braces in night and day every time. And second thing, as madam told, some backache, neck pain, this and all can come because of the sagging of the breast tissues. And further on, there will be also skin laxity also in this region. Yes, there will be some skin laxity which can cause more irritation. And also other thing is that when there is a huge breast, there will be always chance of fungal infection also, because there is a fold between the breast and the skin which can cause some unnecessary sweating and then fungal infection. All this will cause a functional problems also, but also a cosmetic concern also. So in a cosmetic surgery,
yes sir, enhancing breast. See, let us take that one. What is the procedure?
See, when a patient comes to me for a breast enhancement, we always counsel them first. Like, do we really need it? That is first thing. And why does she need it? And how much we can improve it in a practical ways. See, they might ask for a huge breast, but for every patient we cannot do how they want to do. So what I do is that I counsel the patient. I ask them, what do you want and how much enlargement you say. How do we say? We usually take a cup size. Like you go to a normal shop, they will tell you A cup, B cup, C cup, D cup. So whatever she has present cup size, if she wants to increase 1 cup size or 2 cup size. So that is how we get an idea what our patient wants. Once she tells me what she wants, usually in a surgical way we have 2 methods. One is called as breast implant and second is called as fat grafting. There are 2 things. Breast implant is something where we use a silicone breast implant, which is a commercially available implant, and that we place into the breast of the lady. In fat grafting, what we do is we take their own fat from the abdomen or the inner sides of the thigh and then process the fat and then inject it to the breast tissue. These are the two common methods we use.
So in these 2 common methods, any side effect will happen, sir?
Definitely. See, when you tell breast implant, yes, side effects can be there for some issues. That's why we do the workup before itself. Before putting a breast implant, we always do some blood test.
Pre-test for that?
Pre-test, we do some basic blood test, whether the hemoglobin is low or high, whether her healing is good or no. Because see, this silicone breast implant is one of the safest procedure. It is, if you ask me, if you...
See, sir, one doubt. See, implant a steel. Okay, we can understand that one. How to implant a silicone, like a gel thing?
See, the silicone breast implant comes in the shape of the breast itself. It is very soft and smooth. It is not like a liquid. It is more of a cohesive gel material. The gel material inside this implant is made of 2 layers. One is that silicone gel. Outer there is a capsule, which is very strong. So it is so strong that if you keep the implant under the tire of the car, it won't burst. Even if the car goes over the breast implant also, it does not burst. So that is the safety of the breast implant.
How to match the skins, that one, sir? How this silicone, how to
See,
match
basically we keep the silicone breast implant not inside the breast. We keep below the breast, above the muscle. There is a layer, like when you tell the layer, there is skin, there is a breast tissue, there is a muscle layer. So we do not disturb the breast tissue. That is why when we keep the implant below the breast tissue, so it will not affect any issues with, like, for example, feeding. There will be no issues with feeding for the mother. Because we are not touching any breast tissue there. We are just keeping the implant below the breast tissue. And second thing, since it is very soft and pliable, it will not look artificial also. People will not make out that it is a breast implant is placed or not also. Why? Because above the breast implant there is a breast tissue. So that will give a natural counter. So obviously enhancement will not be made out whether the surgery is done or not.
So during this procedure, sir, how to decide the size of the breast, sir?
See, the size of the breast implant varies a lot, from starting from 200 cc to 500 cc. We can't measure in the amount of cc. Like it's an ml kind of thing. And that varies. How we choose the size of the breast implant is that basically we have something called as breast implant sizes. We have a artificial breast implant sizes that we keep under the bra of her. And we ask her to see in the mirror whether that projection, that improvement, that enhancement is enough or not. So that we ask them, that is one thing. Second thing what we do is that if a patient asks me, like, no, doctor, I want to put 500 ml of breast implant, which is a big breast implant, then I have to check the skin pinchability. See, to keep a breast implant, I need a space also. If there is no space, if she is a very thin built, short, thin girl, I cannot put 500 ml breast implant there because there is no space to keep there.
Later it will have health issues.
Health issues. Obviously, it will become too awkward and it will become too artificial. See, when you do a cosmetic surgery, it should look very natural. That is the essence of cosmetic surgery, that you should look very naturally, and people should not make out that you have got a cosmetic surgery done. So breast implant, definitely it varies with the different sizes, but based on the priority of the patient, based on my examination, we come into one decision that no, this much amount of CC we'll put to this time. This is what we
sir,
tell.
after the procedure, how long it will exist?
See, breast implant, it's an inert subject. It's a very good product which doesn't get so easily infected. So once we place a breast implant, usually it stays for 15 to 20 years also. We needn't worry about that unless she has some other issues like probably some infections in her life or some injuries or something like that. Then probably we might need to remove the breast implant. Otherwise, usually if we keep a breast implant, if she goes very smoothly, there is no issues in health, then it can continue 15 to 20 years also. But yes, for example, if I put a breast implant age of 25 and that time her breast is in one shape, and after 20 years her breast will not be in same shape because she has gone through pregnancy, she has gone through regular menstrual cycles. So many changes happen physiologically in her breast tissue. So the size and shape changes at the age as you age. So that time what we give them offer is that that breast implant may not be matching to her present breast size at the age of 45. So what we do is we do something called as breast implant exchange. So we go through same wound, remove that old breast implant and put a new breast implant which is better for her breast at that age. So that we call as breast implant exchange. Otherwise breast implant will stay in the body without any issues for her.
Okay. See ma'am, actually this is a private part. How the patient came and how to present these things?
Yes, see, most of them are a little shy.
Yeah.
Younger females are accompanied by the mother or something.
Yeah.
See, like we have few patients, one breast is developed and another one is a little smaller.
Yeah.
As sir told, genetically only they might have like
correct.
that. So these are the very good options what they can have, because at that growing age, they'll have a lot of psychological upset. Not only breast size is small. So one is normal and one more is small. So all these things mother comes, they come along with the this thing. But yes, in younger age group, reproductive age group, once that pregnancy and things like that, if they have genuine problems like pain and things like that, so obviously that pulls them to a doctor. Neck pain, back pain, or they're having difficulty in getting their bra size also, because after pregnancy, breasts can become really huge. The size can increase to a great extent where it is very much uncomfortable for them. Not only look wise, but it will be very difficult for them clothing or pain wise also. So that
see ma'am, after the procedure during the pregnancy period, will they have any difficulties, any uncomfortable?
Like after implant, you're asking?
Yeah.
So after implant, no. As sir said, you're basically putting the implant under the breast tissue. So breast tissue as such is not getting affected. So they can feed the baby. Like imagine after one
delivery
baby,
also they will not have any problems.
No. That's all. After one baby, they want a breast implant. They're planning for another pregnancy. So that can be done. So that is a safe option. There's no harm to the feeding the baby also.
Okay. See, sir, you already told that a sagging breast. How to solve that one?
See, sagging breast tissue is something, we have two problems there. One, the weight of the breast itself might be very high, because after multiple pregnancy or after many going through her life, she might have a very big breast. Breast tissue itself might be very big, so that is very heavy, and that is not, the body is not able to maintain that. So what happens, there will be a lot of sagginess there. So that can cause backache, neck ache, and some fungal infection in these regions and all. Other problem is that sagging of the skin itself. Like the breast tissue is small, but the skin is very saggy because of aging. As you age, the skin will start sagging down. Like it will not be very tighter and other things. So the nipple should be at the age of, ideally when we tell, the nipple of the breast should be at the level of mid-arm circle, this level, at the mid-arm. If the female is getting this, it's going downwards and is reaching this level, that means we need to do something called as breast reduction mastopexy. This is a surgery where we reduce the breast and get into the shape. See, breast reduction is, if there is a bulky breast, then we reduce some amount of breast tissue to get into the shape. Mastopexy is a surgery where we just do the shaping of the breast. For example, I told there is no breast tissue, but only skin is sagging. Then what we do is we do treatment for the skin, so that breast is pulled upwards, so that it comes into the good position, so that she needn't wear all the time bra, because otherwise she has to wear the bra every time, because to support that weight, she has to wear the bra every time. And second thing, obviously in the outside world also, if it is too saggy breast, people will start seeing her. Unnecessary social attention is very, very common. So most of the female, I consider this breast reduction as not just a cosmetic surgery, it is also a functional
Health issue,
surgery.
yeah,
It is both the things. And if a husband supports this for the surgery, that is very, very good. Because this is one of the surgery I always, usually when a patient comes to me for a cosmetic surgery, we don't push to any surgeries. We ask them what is their wish. But in this surgery, I suggest them to go for this surgery because this is one of the surgery which will give them big help. Because backache is very, very common in every female. Because that is very,
These
very
are like,
common.
as you said, the unspoken problems.
Yeah.
What
So
a
many
female
females
goes
will
through.
not talk to their husband or their
Openly,
mother.
yeah.
They will not open up.
Even
And
with the husband, it's very difficult to openly tell all these things.
things. And second, they cannot tell to their friends also because obviously this is a very private part, so they will not be able to tell. So usually we ask the patients to come and open up to the doctors itself because we don't judge the patients.
Okay.
If they come for they want to increase the breast or reduce the breast, I don't judge them as a person because I am a doctor. I will tell her is it needed, how can we do, and what are the risks and benefits out of this. Then they can decide whether to do or not.
Okay. How long? See, for this procedure, how long it will take, sir?
See, procedure is, if you're doing breast implant, it's just a daycare surgery. You come in the morning, you do the procedure in the afternoon, you go back in the evening. You can go back in the evening. Only thing you should do in the home is that probably first 2 to 3 days after surgery, you should not do jumping exercises, weightlifting kind of thing. But they didn't get admitted to hospital after the breast implant surgery. If you're doing a breast reduction surgery, like you're doing reducing the size, yes, that is little bit bigger surgery. So what we tell them is you should stay in the hospital for 2 to 3 days and full recovery will take around 10 to 12 days because there will be some stitches there, so that has to heal. So usually 10 to 12 days and then they can go back to the work.
See, in this both surgeries, later, will they have any health related issues?
Not really. Not because of this itself will not have health related issues. But yes, they can have other issues which can be problems sometimes. But as is doing the surgery, because of this surgery, they will not have any health related issues with that. See, there are always kind of misnomer that because of breast implant they will get breast cancer. See, such things are all proven wrong. It is not really true because breast implant will not cause any breast cancer issues there. So that has been proven now. And even these surgeries will not be affecting their health, day-to-day health issues. Nothing will be affected to them. It will be very safe surgery.
Here we are winding up Meditrack program. In this program, your viewers have a prominent information about breast related issues. Here is two doctors, Sashirekha Multi-Speciality Hospital, Dr. Prajwal, plastic surgeon and cosmetic gynecologist and fertility specialist, Dr. Sruthy ma'am here. See, if you have females have any birth related health issues, you can approach the doctor. They are very happy to resolve all that problem. Thank you, sir.
Thank you.